Hi, it's Dr. Sharma here from the Sharma Clinic, and today we're going to be discussing the male aging face. So I think in our practice we're seeing more and more men who are coming to our doors seeking anti-aging treatments. But one of the main concerns we hear time and time again is, will I look too feminine? So personally, I think things have turned around slightly now. We live in 2019 and these treatments are very acceptable for men. As we take care of our bodies, we also want to take care of our face. So at the Sharma Clinic, we offer a package of treatments which are particularly designed for the male face. Sometimes we address male aging, and sometimes we address the younger male face who wants to look more athletic, more masculine, and different the jawline. So in this video, you're going to see one of our patients. His name is Mitch. He's in his late 30s. He's a very athletic, buff guy. His body is in amazing shape. Recently, I saw him for a hair transplant procedure, which went very, very well. He then asked me, what can I do about my face? So as men, a lot of us like to go to the gym. We like running, we like doing weights. And oftentimes I find that patients who have very little body fat percentage start to lose fat around the face quite aggressively. And this often leads to that very gaunt look and the face looking older than the body. In the Male Rebalancing Program, we often augment the jawline, the chin, and also the mid-face. And everything is designed to make the areas of the face which promote masculinity to look a lot more chiseled and defined. Personally, I believe the under eye area is of paramount importance. So I would start there because this often gives the biggest bang for the buck. I think this is why it's so important to focus on one area to make it look amazing and then move on to the next area. For Mitch, we started off with the angle of the mandible and the ramus of the jawline. We used approximately 3 syringes in each side to achieve 100% of correction. We then moved on to the under eye area and we used Redensity 2 by Texoane, which is the only filler which is designed particularly for the under eye area with light reflecting technology. Here we used 3 syringes to correct the tear trough to 100% of its potential. Finally, we moved on to the mid-face, and here we used Texoane RHA4 technology. The RHA4 line is a fantastic option for men in the mid-face because the filler actually moves with the face, which provides natural, undetectable results. We used 1 syringe of RHA4 from Texoane on each side of the mid-face. This had him looking more angled and more chiseled around the mid-facial area. So in the before and after, you will see that Mitch is looking stronger, more angled, and more chiseled. He also looks a lot more youthful. He looks about 5 years younger in my personal opinion. This was all done using Texoane's filler line, which I very much enjoy. And finally, this was all done without any scalpels. It's non-invasive, the results are immediate, and then he'll come in for yearly top-ups. The most important thing to take home about anti-aging treatments, it's a project. It's like going to the gym. It's like taking care of your body. We're taking care of our face. We need to put in the work and maintain these. So Mitch will come back in approximately 8 months' time, and he will require far fewer syringes than the first appointment, and it's simply maintaining his beautiful looks that we've attained. Well, thanks very much guys for watching this video. It was a pleasure treating Mitch. He was a great patient, great sport. And if you want to learn more about Texoane's filler line, check the link below. Or you can go into Clarion Medical and check out the fantastic suite of medical procedures and devices which they carry. My name is Dr. Anil Sharma. Thank you very much for watching, and we'll catch you next time.